Sneha, it's such a, in India especially, when you say public place, your own house can be a public place if you're in a joint family.
I think the best thing to do is what I would think is that just go back to masking. I think that's the simplest way, Nabila.
But that's what, then in that case, you're going to mask everywhere.
It doesn't take much to mask up, is what I would say. Like, though personally, many of us wouldn't want to go back to it, but I think, like I said, that's the simplest thing that you can do to actually protect yourself.
No, but precisely what I'm saying, what's a public place? Would you call our office a public place?
Yes, I would. It's a crowded place, it's indoors. If you can bring in one of the doctors. Dr. Parikh, if you allow me, Nabila, I'd like to ask a question to Dr. Parikh. Dr. Parikh, indoor spaces obviously are riskier than outdoor spaces, as we all know, that it's airborne, the infection is airborne. Hence, all the more important to mask up at least in indoor places?
Of course. Depending on the circumstances, one would need to do that. Pleasure to be with you, Sneha and Nabila. The two of you, with your remarkable coverage over the past 3 years, could easily be the panelists, and I could be the curious character asking you questions. But yes, one cannot reiterate enough the significance of masking. I have been doing it for the last 3 years. I haven't held back. I've been following COVID protocols, washing my hands, keeping distances. But there's one thing I'd like to add which would emphasize this adequately, and that is, the new variant BF7 has an R naught of 10, which, as of course you know, means quite simply that 1 becomes 10, becomes 100, becomes 1,000, 10,000, a lakh, million, so on. So it is spreading very dramatically. In all probability, we are going to see the mother of all pandemics, at least in China, something that has never been witnessed before in a country. And therefore, with all these developments just across the border, we cannot be adequately prepared. We must be very, very cautious.
I have a question on that. The visuals that are coming from China, it's really nerve-wracking. You have people, falling dead like flies. Is it really the BF7 variant, or is it just the fact that China really never opened up? They have this whole zero COVID policy going right from the start to now, barely any immunity, and now when they've opened up to herd immunity, and boom.
Probably a combination of all of that, but it's going to get even more sinister. Now, Airfinity, in its computer models, it's a UK-based company, in its computer models, is telling us that there are going to be 40 million cases daily in China in January and February. Shanghai, a city of 25 million people, half of that city is going to be infected. And as you pointed out, they have done a complete turnaround from zero COVID to opening up completely. Their vaccine hasn't been the best. When we wrote our vaccine book in 2021, January of 2021, when the trials were going on and no vaccine was out, we pointed out that these trials were shoddy. They had 2 vaccines they were trying without informed consent on factory workers, even the workers who were working in the factories that produced the vaccines, and they were interchanging the data. So there was already something sinister about the way the vaccines were being created, and that is borne out now. In head-to-head comparisons, the Sinpharma vaccine is the weakest of the lot. So vaccine nationalism, inadequate trials, and zero COVID, it is a perfect storm. It's a recipe for disaster.
Nabila, I want to ask a question to one of the guests, because
I should say that I'm so proud of India's achievement with the vaccine. It's been globally
an inactivated vaccine that we've used, and also Covishield, which has given us fair amount of protection, including the 3rd dose in that sense. Nabila, I'm just going to go back a little to ask Professor Mande this question. We know that BA.7 was in India in the month of July, August. In fact, we've spoken about this on the 11th of October to be precise. I want to ask you, if the reproductive value or the R value is up to 18, 10 to 18, which means, Nabila, that one infected person can infect up to 18 people, which is not the case with the original Omicron variant, which had the RO value of 5, which means one infected patient could infect up to 5. This is actually more than double. It's up to 18. How is that, Professor Mande, that we've not seen an explosion of cases in India up until now? Is it because we're not looking for these cases, or is it because of something else altogether that's happening in China that we don't know about just yet? And it's really not BA.7.
what we know is that the R value of Omicron itself was much higher than Delta.
Yes.
And BF7 is higher than the original Omicron that what we had seen earlier. But what has happened is that because of the vaccination, we have delivered about 2.2 billion doses of vaccines. And because of our immunity that we developed, because of prior exposure, most of the Indian population, even if it gets infected, what we believe is that the infection would only show up in terms of mild fever or running sore throat or running nose or something like that. And hospitalizations and much far less mortality is what actually we would expect, is what I believe. I hope Dr. Sareen agrees with this. And therefore, what would have happened is that even if people had come down with mild fever and all, possibly people would not have tested for COVID, and therefore we have not seen that kind of an explosion in India. At what correctly pointed out by Dr. Parikh, because of multiple reasons, China is seeing an explosion, which is a concerning situation for the world. But at least in India, we have not seen that kind of an explosion because of two reasons: very high coverage of vaccine doses and our prior exposure. Both these hybrid kind of things, together we have not seen an explosion of BF7 in India.